All right, so same setup in regards to the patient, right? That's almost never going to change unless they have certain unique circumstances that need to be accommodated for. And what I did before was I pulled the pillow out from underneath the shoulders. Kobe, you kind of got a long head, so you can scooch down the table just a little bit. There you go. Yep. Not that long of a head. You can come back up a little bit. There you go. But this creates a trough, right, between his shoulders and the pillow. They may want to scooch up because they're not used to just having the pillow support their occiput or just their neck. But this allows me to be able to have their neck suspended without me having to lift it or do a lot of heavy effort. Okay. So the one thing that is going to change here is that I'm going to raise it until the apex of his head is at my navel, give or take, right? Some people have longer arms, etc., but I'd start there and then I'll find your own nuance thereafter. Yeah, looks pretty good. All right, and then with this technique, I'm actually going to take the patient, I'm going to move him over to the side. There you go. Yep. So those same principles as far as my short applicator apply. I'm going to be over ear, or above ear, over ear, under ear for my upper 3 segments, and then lower down for each subsequent segment. The contact point, again, is going to be on the articular pillar of my proximal phalanx. You can use your middle and or index independently of one another. I like to use them both together. It gives me something more rigid and a better contact point than any one finger alone. Before I worry about my short lever, I want to own the long lever when we're going through the chin grip. Okay, so I'm gonna get my free rotation by just laying my hand and my forearm next to him, and then rolling his head onto my forearm. And then we need to be very conscious. People have like this protective reflex when you're like under their chin or around their jugular. So it's very light. I'm on the mandible with my good finger and my ring finger. So it'd be like that, okay? And then my 5 points of contact are gonna be on my finger, palm of my hand, forearm, and then my pec or breast tissue, right? So it'll just be like this. And I should be able to have, before I worry about this guy, I need to be able to have control in each plane, okay? So I already got my rotation. I can side bend. I can go into my PA, right? And be conscious that it's really a combined motion, not just like yanking up on their mandible with your hand. And so the scoop comes by being a little bit more athletic and by bending my knees. The side shift I can also apply independent of my short lever. My short lever is going to come in, again, elbow out over above the ear for my C0, where I would go free rotation, side bend, side shift, PA, and then I'd be doing a high arc of rotation like that if I was going for Z0 or Z1. C1, C2, it's a little bit more shallow but still a relatively high arc. C2, C3 and below is going to be at each additional vector accordingly. And then as I get lower, so here's my C0, C1 above the ear, at the ear with elbow out, where I have that rotation, and I'm able to apply the vectors of side bend, side shift, extension, or PA, and then that thrust there. Come below it, and I'm at C2, C3. Same vectors would apply. I get a little bit lower. Again, as we alluded to with the cradle grip, is that we can also flex just a little bit if needed to get to the lower segments. Again, as we get down here, it gets a little bit more difficult because the additional thickness of the neck increases, and thus you need to be able to take up your vectors and your slack accordingly. Okay. Unlike the first cradle grip that we went through, right? The chin head grip requires a lot more ambidextrous nature, and so I would encourage you to practice it on both rather than just on the one side. And the other thing that is unique beyond the differences that I've already delineated is that I'm at the corner of the table, I'm around the table, right? Hence the reason why I move the patient off to that side. It allows me to be able to better apply that force appropriately, not muscling it with my arms, but rather getting it through my hips and my shoulders. All right, so why don't we try the chin head grip.